Hi, I'm Amy McCarter. Welcome to HouseCalls, brought to you by KaMMCO, where Kansas healthcare professionals deliver health insight. Today I'm speaking with Sarah Sachs-Jepson, family nurse practitioner, about skin cancer. Appreciate you being here today, Sarah.
Sure.
May is National Skin Cancer Awareness Month, and what are some things that people should be aware of as we head into the summer months?
Skin cancer is the most common form of cancer in the United States, and in most cases it's preventable if you take appropriate measures to protect your skin from the damaging effects of the sun. Skin can be damaged by the sun in as little as 15 minutes, so it's important to cover your skin, use sunscreen with an SPF of at least 15, and stay in the shade as much as possible, particularly between the hours of 10 a.m. and 4 p.m., which is the time of day when UV rays are at their strongest. You should also remember to reapply your sunscreen at least every 2 hours, and more frequently if you're in the water or are sweating, despite whether the sunscreen claims to be waterproof. Wide-brimmed hats and sunglasses are also effective in protecting the head and face from the damaging effects of the sun. Also, avoid using indoor tanning beds since they're just as damaging as direct sunlight. Any change in the color of your skin from being outdoors or in the sun indicates damage. Tan skin equals damaged skin.
Are some people at a greater risk of developing skin cancer than others?
Anyone can get skin cancer, but there are some factors that increase the likelihood of someone developing it. Fair-skinned people with blonde or red hair and people with blue or green eyes are at greater risk of having skin cancer. A family history of skin cancer or a personal history of melanoma are also risk factors. Having sunburns early in life can also put you at greater risk, so it's important to be vigilant about protecting our children's skin when they're in the sun. You should also remember that sunburns can occur even on cloudy days, so taking precautions every day is a good habit to get into.
Now, I know that it's recommended that we monitor our skin and our moles. How do we know when something might warrant further evaluation?
There's actually an easy way of assessing your skin called the ABCD rules. The A stands for asymmetry. A lesion that's not symmetrical, which means one side is different from the other, can indicate cancer. The B stands for border. Cancerous lesions have uneven, irregular, or undefined borders. The C stands for color. Moles or freckles should be one consistent color. If the color is uneven or there is more than one color, particularly black, the site needs to be further assessed. Finally, the D stands for diameter. Lesions larger than 6 millimeters or about the size of a pencil eraser are suspicious. If any of the above rules are true of a lesion that you have, you should contact your provider and a biopsy of the site may be indicated. There are 3 different forms of skin cancer. Basal cell and squamous cell carcinomas are the most common and are highly curable. Melanoma is the 3rd most common and can be very dangerous and may even lead to death. Typically, skin cancer is easy to treat and if caught early is highly curable. If you notice a mole that's changing in size or shape, or if it meets any of the ABCD rules, you should notify your provider as soon as possible to schedule a full skin assessment.
Okay, great. Thanks for being here today,
Sure.
Sarah. Please join us next week for a new health topic discussion on House Calls.